complete trial was recently presented and published simultaneously in New England Journal of Medicine. This trial, investigators tried to assess a very common and important clinical problem as we as interventional cardiologists face every day, namely patients with STEMI undergoing primary PCI, very often up to 40% have non-culprit lesions that we detect at the angiography. The question was, should we also intervene upon those non-culprit lesions, and when should we do that? There have been 4 prior trials trying to address this. All 4 were underpowered to look at hard clinical endpoints, CV death or myocardial infarction, but they have shown a consistent result, mainly driven by a reduction in repeat revascularization. This trial, the complete trial, enrolled 4,000 patients, which was powered to detect a difference in cardiovascular death and myocardial infarction. The trial was very well performed. It was a very limited crossover between groups, so patients who were assigned to complete revascularization to a very large degree received complete revascularization, which really normalized their coronary arteries. The trial showed a very impressive reduction in the primary endpoint, CV death and myocardial infarction, and also an impressive result in reduction of the co-primary endpoint, which was CV death, myocardial infarction, and ischemia-driven revascularization. This difference, the primary endpoint difference, was driven by a reduction in myocardial infarction, and not only small myocardial infarctions, but clinically important type 1 myocardial infarctions, STEMI as well as non-STEMI. The results were consistent across all subgroups. I think this trial really makes it possible to upgrade guidelines that this is something we should actually do in all patients with myocardial infarction presenting with a non-culprit artery stenosis. There were, of course, limitations with this study as always. It was open label for obvious reasons. They did not address whether or not an FFR, if coronary physiology measurement, could improve their results even more because it was based on eyeballing on the degree of stenosis. But except for minor limitations, I think this is a groundbreaking trial that informs us to better treat patients.